All right, welcome everybody. I've got a question in the chat about slides. Yeah, we're more than happy to share the slides with you all after the session. I will say these slides particularly don't have much content, but I will defer to our lovely speakers to see if they are willing to share their slides. Okay, got a thumbs up from Sabrina, so it sounds like we will be able to share those with you all. I'm flying blind because I cannot see the clock on my computer, but looking at my watch, it's 3:02. We could likely get started with introductions and background and let folks join in as they come. Thank you all for joining us today. Really excited about what will be a wonderful and informative session today on distinguishing advocacy, lobbying, and education. A little bit about our agenda. This is kind of what we're planning to do in terms of talking today with you all. I'll do a little bit of brief introductions, and Lindsay will talk a little bit about our project and kind of why we're here and what we're doing. And then we will turn it over to Sabrina Adler and Alan Madison to go over some definitions, guidelines, and challenges around distinguishing advocacy, lobbying, and education. Then we'll get into some question and answer time. We'll have a large majority of this session devoted to answering your questions, a number of which were actually submitted online in the registration process. So we have a lot of questions to get through there, but we'll also look forward to having your additional questions as a part of this session too. Thanks, Lindsay, for shouting that out in the chat. So if you don't mind, please share what affiliate you're joining us from in the chat. Alrighty. So first, I wanted to just introduce myself. My name is Raya Griffiths. My pronouns are she, her, and I am a program manager here at APHA, specifically working on our public health authority project for inside of the Alliance and affiliate affairs as well. I'm really pleased to introduce two wonderful guests we have today. First, Sabrina Adler, who is Vice President of Law at Change Lab Solutions. She works primarily on legal and policy issues related to preemption and good governance, the commercial determinants of health, and healthy children and families. She's co-authored publications and presented on many issues at the intersection of law and public health. Sabrina graduated from Brown University and Stanford Law School. Alan Madison is joining us as a partner at Trista Ross. Alan helps nonprofit organizations to mitigate legal risks while maximizing their ability to advocate effectively for their public policy missions. Alan is an expert in the law and policies around educational and lobbying activities, specifically for nonprofits. Alan has published numerous articles on the relevant laws and codes governing nonprofit advocacy. And Alan got his JD from Georgetown University Law Center and his BA from Washington University in St. Louis. So really pleased to have both of you. Thanks for joining us today. I wanted to take a moment to shout out some upcoming sessions that we have. We are really excited about continuing this series that we have going on here and talking about power mapping with our friends from Voices for Healthy Kids, an initiative of the American Heart Association. That will be on January 26th from 3 to 4 Eastern and numerous other time zones listed here. So that'll be really exciting, and I will be sharing more information with you all on how to register for that and what we are planning to discuss in that session. We will also schedule future sessions similar to this one on communications, the discussion of 2022 legislative trends with our partners at Act for Public Health, and do a media training as well. One other thing I wanted to mention is an upcoming APHA policy statements for state affiliates training. So the link is here, and I will ask if Lindsay can just kindly put it in the chat as well. That is exciting, and we hope to see you there. With that, I will turn it over to Lindsay, who can say more about the policy statements training and a little bit more background on our work as well.
Thanks, Raya. You guys ever be doing 6 to 7 things in a Zoom at once, and then all of a sudden it's time for you to talk? Because that's where I was. Hi, everybody. I'm Lindsay Wahoyak. I'm Director of Affiliate Affairs at APHA. I use she, her pronouns. To give you a little bit of background on what we're doing here today, Raya has already touched on a little bit. First of all, the Alliance, and certainly the work that we've been doing with our partner organizations, LSSC, American Heart Association, Network for Public Health Law Watch, Temple, Change Lab Solutions, and the Public Health Law Center. Oh, so many laws. But we're all working together on an RWJ grant that's working certainly with 7 different states, including 6 different affiliates, all talking about public health authority. And one of the ways we advocate for public health authority is we do advocacy. But the number one thing I hear from our state public health associations at APHA is, yeah, I can't do advocacy. My boss won't let me. Or I work at the state, so I can't do advocacy. Oh, friends, how possibly right or wrong you are. So we get a couple of trainings every year on, okay, so what is advocacy? What is advocating? What is education? What is lobbying? And who can do what at a nonprofit organization or as an employee of your state health or state or local health department? So when Raya said, oh, okay, what kind of training should we be doing specifically? I said, this is the number one thing. This is the thing that everybody asks for. This is the thing we talk about every year. Who would be calling me right now? I don't know. But it's a perennial and evergreen topic. We want to make sure that you at your state public health associations or the organizations that you work for outside of your state public health association are equipped to do the most good to make sure that public health is at the forefront in the coming legislative session. And so that is what brings us here today. So I'm going to kick it back to Raya so she can get us started.
Great. Thank you, Lindsay. Thanks for that background and for jumping in, even amongst the other things that you have going on. Perfect. So, excuse me. With that, I actually will turn it over to Sabrina and Alan, and we can get started on kind of the meat of what we're going to be discussing today.
Great. Thank you, Raya. Thank you, Lindsay. I'm just going to try and get my screen shared and hope that it all works. So give me one sec. Okay. Can you see?
Yes, that looks good.
Lovely. Okay, great. So thank you for having us. We love to present on this topic, particularly with Alan, because he's really actually the expert here. So we're glad to be here to provide this refresher on advocacy and lobbying, thinking about how to draw those lines in relation to your own work, and really most importantly for the presentation part of this as a grounding for more questions and conversation. So I'm going to run through some basics, but I suspect where the interest is in some of the nuance. So that's where we will go after this. I also just want to give a shout out to my colleague Sarah, who is on the call today also, who did a lot of the refining and prep work for this with me. So thank you to Sarah. Really quickly, for those who aren't familiar with us, Change Lab is a nonpartisan nonprofit organization. We use the tools of law and policy to advance health equity. So we work in communities all around the country to improve health and opportunity by changing harmful laws, policies, and systems. So I'm an attorney. We have an interdisciplinary team that works with community organizations, governments, and local institutions to design and implement equitable and practical policy solutions to complex health challenges. So some of you may have worked with us in the past, and for others, we may be a new face. Raya and Lindsay touched on this a little bit, but we are working as part of a larger group on applying our experience in public health law and policy to really work on the issue of public health authority and infrastructure. So these are the legal partners that you see on this slide, many laws in the names, yes. And we are also working with APHA, LSSC, Heart Association, et cetera. Quick disclaimer, as a lawyer, I'm going to talk about a lot of legal issues. I'm not providing you legal advice. You will need your own attorney if you would like legal advice, and that is, for better or for worse, not me. Okay, so this is what I'm going to talk about over the next 20-ish minutes. I think you are all aware, and that's why you're here, that there are many public health policy and advocacy activities that do not constitute lobbying. So I'm going to go through what exactly does constitute lobbying, what those definitions look like, the most common restrictions on lobbying activities, and then how to think about non-lobbying advocacy, that whole world of advocacy that is not lobbying. We are going to talk about general guidelines based on various provisions of federal law. As I said, we'll have time to get into some more specific questions after this general presentation, but also just another reminder that you will want to consult your organization's legal counsel or your employer when it comes to specific laws in your state or any contract provisions, for example, that might apply to your specific situation, with the hopes that this general information can sort of lead you to understand what the questions might be and where you might be able to advocate for yourself a little bit in this space. So I'm going to define lobbying over the course of the next few slides, just to encourage some participation in the chat if you would like to. If you want to type some things in that come to mind when you think of lobbying and sort of share with some of your peers, that's fine. Please continue to interact throughout the presentation. So I'm going to talk about the definition of lobbying in two primary contexts. The first is philanthropic funding, and the second is in when it comes to federal grants. They differ slightly, and you'll see how that plays out as we talk. So first, philanthropic funding. It's important to understand lobbying in that context because lobbying activities are limited by the Internal Revenue Code. And those restrictions pass from funders like private foundations along to grantees through the agreements that they use. So not every foundation restricts lobbying. For example, there could be unrestricted gifts or donations that don't have lobbying restrictions. So it's important to understand what's in the grant agreement if you are getting funding from a foundation. And then also really important to understand that nonprofits are not entirely restricted from lobbying. That can be sort of a misconception. So we'll talk about here Internal Revenue Code 501H, Section 501H. How much lobbying an entity can do depends on which rules that entity or organization chooses to use. There's what's called the 501H expenditure test, or there's what's called the insubstantial part test, meaning that influencing legislation is just a small amount of what the organization does. And the rules that govern lobbying under that insubstantial part test are a little bit more stringent and somewhat less clear-cut. So we can talk about it a little more if there's interest. This is getting really into the weeds, but there's also a resource from a friend organization called Boulder Advocacy. I cannot access the chat right now because I have a full screen here, but perhaps Sarah can pull the link into the chat, or I can do it when we're done. So understanding lobbying is also really important for recipients of federal grants, because the federal government either restricts or prohibits the use of federal funds for lobbying, as many of you probably know. And many state and local governments also prohibit lobbying with government grant funds, or at least restrict the use of funds for that purpose. The specific rules and regulations implementing those limitations are in the resources list at the end, so we'll get there. But for our purposes, we're going to talk broadly about the similarities and differences between the most common philanthropic and federal limitations, and then yet again, drumbeat of more specifics in the Q&A if it's helpful. Okay, so to the definition itself, to be considered lobbying, an activity must include all four of the elements on this slide. So first, a communication. Could be anything from an email to a phone call, a letter, an in-person meeting, an interaction on social media, like a tweet or a DM, Instagram, etc. Must be with a government official or employee, and that's can be a legislator or anyone working for a legislative body, or a government official or employee who participates in the formation of legislation, even if they're themselves not part of the legislative body. And then it has to really be attempting to influence legislation. So reflecting a particular point of view about specific legislation or making a direct appeal to others to do the same. And I'll get to that difference in just a second. So there are two types of lobbying: direct lobbying and grassroots lobbying. Direct lobbying is probably obvious. It's when you're communicating directly with a government official to influence specific legislation. So like I said, emails, phone calls, letters, in-person meetings, etc., but directly with that government official. In contrast, grassroots lobbying is when you're communicating with the public to ask them to influence the outcome of specific legislation, for example, by asking them to take action and communicate with their representatives. It could also include things like phone banking, sending letters or emails that are encouraging the recipients of those communications to take action. So just to highlight the phrase take action, for a communication to comprise a call to action, it has to do one of the following four things. Either tell the recipient to contact a legislator, provide information on how the recipient can contact their legislator, such as phone numbers or email addresses, provide a mechanism to enable the recipient to contact their legislator, like a postcard, petition, or form. So you can see on this slide, there's an example of that, or identifying a legislator who should be encouraged to vote a specific way. In contrast, a communication to the public that reflects a view on legislation but omits this call to action is not actually lobbying under the IRS rules. So there are a lot of exceptions to the general prohibition on lobbying. I'm going to start with advocacy activities that don't constitute lobbying under either the IRS rules or the federal grant rules, and then we'll talk about a few that are specific to one or the other. So coalition building, no matter who it's among, governments, nonprofits, private sector, communities, etc., to discuss problems and share ideas generally, not lobbying under either definition. Sharing your general opinion on best practices or sharing success stories, there's no call to action here. So that is not lobbying. It could be paired with a call to action, which would constitute lobbying, but just that sharing out is not a lobbying activity. Engaging in what we call nonpartisan analysis, study, or research, and making the result of that work available to the general public or even to government bodies, officials, or employees is not carrying on propaganda or otherwise attempting to influence legislation. So what do we mean by nonpartisan analysis, study, or research? We're talking about an independent and objective exposition of a particular subject matter, including activities that qualify as educational activities. It might advocate a particular position or viewpoint as long as there's a sufficiently full and fair exposition of all the relevant facts that would enable the reader, the public, or an individual to form their own opinion or conclusion about what to do. A mere presentation of unsupported opinion would not qualify here. So you can see those criteria on the slide: independent, balanced, and objective, fair to both sides. That's the sort of full exposition I was just talking about that allows a reader to draw their own conclusion based on evidence and facts. And then this last piece, broadly distributed to the public, not just directed to folks on one side of an issue. So posting it on a website, making it broadly available. One thing we do at Change Lab a lot is this develop model policies. Those can be considered nonpartisan analysis, study, or research, even though they obviously advocate a particular policy, or present, I should say, rather than advocate a particular policy approach. There might be different options there. Any specific legislation that's drafted is left to the discretion of the government officials and the body. There's no call to action here. I mean, it's implied. We wouldn't be putting these out if we didn't want someone to use them, but there's no call to action with respect to a specific policy. That said, if you provide model legislation, either in whole or in part, to a legislator or someone working for a legislative aid or who could make that model legislation into a reality, there's sort of a distinction in terms of whether it's lobbying based on when you provide that. So before a related bill has been filed, that would be okay for federal grantees. But once there is a related bill that's been filed, then following up with this sort of resource is considered lobbying. These are just some examples of these non-lobbying activities. So I mentioned model ordinance, toolkits, something we also do a lot at Change Lab, policy scans that just look across what various entities are doing on particular issues. Here's another list of other allowable activities. So general public education, talking with legislators and their staff about policy issues, generally speaking, does not have to constitute lobbying. We can bring legislators on site visits to gain a deeper understanding of public health issues. We can talk to the public about legislation, explaining why it's good, why the city should or shouldn't do something, for example, without that specific call to action. There's also private sector work that can be done, and then responding to written requests. I'm going to get into that more in a second as well. So here are some specific exceptions under the IRS rules, so the Internal Revenue Code. Even if all 4 lobbying elements are present, the following communications are not lobbying. So responses to a written invitation to testify about a bill, even if you're discussing pros and cons, or to provide TA. Get into that in a second. And then also these restrictions from the IRS side do not apply to regulatory actions, administrative actions, and often the decisions or actions of non-legislative bodies that they're nonetheless might make policy, like planning commissions or school boards. So this written request piece, that could include a request for testimony or another type of presentation. These are generally nonpartisan, but you may offer an opinion based on the presentation if the request you receive includes a request for an opinion. And that should be documented. So what that might look like in writing here, there's an example, preferably on letterhead, and email could work too, from the government or legislative body or a subdivision, acknowledging in the written communication that the information will be made available to all the members of the government or legislative body, and the requester must have the authority to speak on behalf of that body. So it could be a chair, committee staff, department head, etc. The request has to ask for an opinion or recommendation if that's something that you are going to make in your testimony or information provided. So moving on to exceptions for federal grantees, there are 2 specific ones on this slide. One is what we call the normal and recognized executive legislative relationships. And then the second is participation in policymaking and administrative processes within the executive branch of the same level of government. So that first one, normal and recognized executive legislative relationships, these are the types of relationships that typically exist between the legislative and executive branches of the government. So for example, the health department typically provides an annual state of the health report to elected officials with recommendations on legislative action, or state legislative liaisons typically consult local health agencies about pending legislation. And this is one where you may have questions. I think Alan can provide some additional commentary when we get to that point. And then the second piece really reflects the reality that government officials have to be allowed to communicate with other government officials and legislative bodies to discuss legislation or policy. That's just part of doing the business of government. However, using a government grant, lobbying is generally restricted when a government wants to lobby a different government. So for example, if the city wants to lobby a state legislator. So these are some examples of internal communications between government agencies or the executive branch and the legislative branch within the same level of government, some of which we have mentioned. Like I said, this is a place where there might be some questions. It starts to get a little bit more nuanced, like what is typical, what's normal and recognized. For starters, this is a good place to consult legal counsel, but again, if you are thinking of specific instances of this, then we can get into them in the Q&A. It can be a little more fact dependent. So when you're considering all of these things, here are some good questions to ask yourself. Does the funding, that is funding your or whomever's time on a specific issue, include a restriction on lobbying, a specific restriction? Then, if you are restricted, what advocacy can you engage in that doesn't constitute lobbying? How can you walk up to that line without crossing it? And we've talked about some of those ways. which laws or rules do you need to follow for your lobbying activities? And are there any state or local laws that could prevent you from lobbying? That's something we haven't really touched on. There is a resource, the National Council of State Legislatures has a 50-state chart with the statutory provisions restricting the use of public funds to lobby. Usually that involves agencies, but some also relate to local governments' use of public funds to lobby a state legislature. So the link to that chart is on the resource slide at the end of the presentation. And as we mentioned, you will get these slides so you can access that. So what if you realized you have engaged in lobbying? It's not the end of the world necessarily. Maintaining accurate and detailed records is a helpful thing to do. Standard time reporting can be sufficient to show that grant funds weren't used for lobbying activities. And it's important to remember, in most cases and most contexts, lobbying is not absolutely prohibited. So it's important to understand where the funding came from that supported that time. And this is another place where it's helpful to talk to legal counsel. So just another way of sort of framing, what can you do? We talked about some of the exceptions to lobbying. We talked about what lobbying is and the definition. So what's the converse of that? What are some of the things that can be done? This is one sort of framework we use to think about the spectrum of non-lobbying activities when you're talking about policy work. So some of these things, come up to the line. There's one particular one that gets very close or often crosses. So let's go through them. If you start with engage, that is almost never lobbying. So we're talking about getting people excited about a vision for change. Some of the things we talked about, building a coalition, doing general education about an issue, talking to people about what public health authority is and why it's important in the context of the most recent work we've done. Then there's a category of work about assessing, looking at what the problem is, what's the data, what solutions are there, collecting, analyzing, and sharing that data, and things like fact sheets and reports. That also is almost never lobbying. We come to the propose phase of things that can be lobbying, but there's also still a lot that's not lobbying. That could include drafting a strong policy that expresses a vision, could be model policies like we discussed already, policy recommendations that aren't specific bills, for example, institutional changes or changes in practices that aren't specific legislation. And then there is the piece that is specific legislation, and that's where you want to think about what is lobbying and what is not. Then advocate, this is where lobbying usually takes place, but even here there are some exceptions. So it could be identifying and meeting with decision makers, but just meeting with them, learning who they are, talking about your work generally, sharing your concerns, that part is not lobbying. It's just when you ask them to take a position on a bill, a specific bill. So sharing best practices, success stories, etc. Obviously, if there's pending legislation and you're sort of skirting around the issue of asking them to do one thing on the specific pending legislation, that's where you want to be a little bit more careful, but there's a lot that gets you up to that line and not across. And then there's the whole piece of what happens after a policy is passed. It can be really important. So talking about implementation, how things are enforced, making sure things get put into place and are followed. And that piece is also very rarely lobbying. So we're just going to wrap up and then I think open for questions. I'll hand it to Alan to sort of provide any opening commentary he wants to give, and then we can dive into questions. But just recap. Lobbying is allowed unless there are specific restrictions. These restrictions vary based on funding and contract language and federal, state, and local laws. As I hope we've driven home, there are a lot of activities that constitute advocacy that are not lobbying. There's also a piece here we didn't have as much time to get into, and again, this is something we could dive into a little bit in the Q&A if it's helpful, but this separation between what you're being paid to do and doing in the course of your job and what you're doing on your own time. And then again, I'm not your lawyer, Alan is not your lawyer. It's important to consult legal counsel when it comes to these issues. A couple of resources, no need to write these down, you'll get the slides like I said, but there's just some background information. We have some recorded webinars on this on our website. There are some other links here that may be helpful, that National Council of State Legislatures chart that I mentioned, and some other organizations that do advocacy education for various groups. These are some of the resources we have on public health authority specifically. We have a TA, a place where you can request TA on public health authority, and that can also be done through your APHA partners, or we have a mailing list as well that you can sign up for. And then I think we can hand it over for questions, and I think maybe I'll unshare my screen so we can actually see each other. So let's see. Okay. Oops.
So Alan has already been tackling some questions that have come up in the chat in response to the presentation. Alan, did you want to share anything else following at a higher level before we dive into some more specific questions?
Yeah, sure. Just two big picture points. One, which was important that Michael Dumont raised, sorry if I mispronounced her name, which is these rules really are important regarding the spending of funds, either through your staff time in your organizational or your government role, or spending money directly on things like ads or what have you. But and it really depends on whether you're at a nonprofit or whether you're in a government role. The government, every level of government has different sets of rules that apply, and depending on where you're getting your funding. So those rules may or may not align with exactly everything that we're talking about today. But the big picture to keep in mind is that we have to view all of these organizations, government, non-governmental organizations, corporate, as part of a policy change ecosystem. And so even if your role as a government public health officer may constrain you from doing lobbying, you still have a hugely important role to play in advocacy, which is, as Sabrina mentioned, getting legislators to do site visits, getting them to understand what's going on in your community, educating people about all of the data that you're seeing, and more importantly, getting them to connect with the community through stories, because it's stories that are going to change policy. And so even if the rules say you can't lobby with this grant, or you can't lobby in your role as a government public health officer, you still have an important role to play to get public officials excited about policy change and understanding the need for policy change. And then others within that policy change ecosystem from other nonprofits will step in and take the ball further down the field. So there's a huge amount you can all do.
Alan, what you just said is a perfect transition to one of the other sort of logistical questions that came through the chat during the presentation, which is, I'll recopy it into the chat, but it's like an associative property of lobbying. How can we help folks make the most and optimize those partnerships where if they are in a position to not lobby, but they've got close partners who are able to lobby, how do you draw those barriers? So the question is specifically, if someone from a coalition gets up and shares a story, and then they pass the mic to somebody who can lobby, who can make the call to action, how would you draw the boundaries in that or in any kind of comparable situation where you're passing the baton?
In most situations, in something that, so let's take the example of a meeting. Often the way people will phrase it is they say, look, I'm going to go into a meeting with a senator, with myself and someone from another organization. And I'm the policy expert, so I'm going to talk for 15 minutes and explain the policy and why it matters. And then my friend Sue from this other organization, she's the lobbyist. She's going to make the ask about legislation. So I won't mention legislation at all. I'll just talk about the need for Medicaid expansion. And then she's going to say, hey, there's a bill on this, you should vote yes. Both of us are lobbying in that situation because Mary's ask would fall on deaf ears if it weren't for me explaining why the policy was so important. And so in that situation, it's, as what Sabrina said at the outset, is we're talking about a single communication. And so that meeting would be considered a communication where Mary and I are both speaking. Because we're speaking on the same topic in the same meeting, it's all treated the same. The better if I don't have the ability, so the best thing to do would be for me to just code my time as lobbying. Like, That's great. We want people at C3s to do lobbying. If you've got a legislator's ear and the ability to talk to them about legislation, by all means, I should be lobbying, right? Code my time, make sure that I have some non-restricted funds that I can use to pay for my lobbying time. In another situation, maybe I don't have the ability to do lobbying, or maybe I'm from work at a government organization and I can't do any lobbying. I can take that senator on a site visit and help them. I can bring them to a clinic where they understand about folks not getting the care they need, and they can learn about access to care. And then Mary next week can go in and say, hey, I know you met with Alan and you went to a clinic. I want to talk about this important bill. So she's building on my initial meeting. Her building on that initial meeting doesn't turn my meeting into lobbying. They're treated as two separate communications. Is that sort of what you were getting at, Sarah?
I think so. And I think too, the question implies conversations that are bigger picture, that are more like events, rather than a smaller scale conversation where it's handing the mic, right, to somebody.
Yeah, if you're having a big event, then you need to decide strategically on the beginning, is this going to be a lobbying or non-lobbying event? And then train folks, give people talking points and get them prepped for it. Angie and I did an event some years ago at the US Capitol, on the lawn of the Capitol building, talking about infant and toddler issues. And we only had non-lobbying dollars to work with. And we had Speaker Pelosi, we had Representative Rosa DeLauro, we had really impassioned advocates speaking. They talked about the issue, but not about legislation, because we said, look, this is a non-lobbying event. If you're talking to a legislator reflecting a view on specific legislation, it would be lobbying. So we explained the parameters to everyone. We set those ground rules, and everyone knew, okay, we can go up to this line because we gave them that training. And so that made it a non-lobbying event. But yeah, Sarah, in your case, if you don't train everybody, and someone takes the mic and then turns it into a lobbying event, all of the costs for that event are then lobbying expenses.
I wanted to take us in a little bit of a different direction, but really appreciate all of that context on lobbying time and events and those conversations. But wanted to pull from a question that we got in the pre-event registration. So kind of just generally about what the best way is to address board members or higher ups that do not see lobbying as part of your role, and or to the kind of the point in the chat to folks who are not allowed to lobby as part of their role.
The best way I've ever seen this described was my kids' summer camp director said the goal of summer camp isn't to get kids outside of their comfort zone, it's to expand their comfort zone. And that's the way I view it with members of the board of directors, is get them to slowly, it's going to take a while, process of education, but we want to expand their comfort zone so that they understand why advocacy is an important part of the organization's role. And so it's not going to be a giant leap for them, but if we can gradually help them understand the role that this organization can play, lobbying is allowed for 501c3s, help them understand how we can define, and what Sabrina was talking about, these 501h rules, we can send around a little explainer that you can give to your board, explaining to them, using these definitions, we can be very clear on what's not lobbying, and gradually get folks more comfortable with that, because it is important for groups to get into more advocacy issues. But the bottom line is not every group is going to be comfortable with lobbying, and that's okay. We need to take groups from where they're at, get them to do a little bit more, and a little bit more, and recognize that there are going to be some times when we have a coalition ally who's going to be the one that carries the, we're going to get the ball the first half down the field, and they'll keep it moving the rest of the way.
I'll jump in quickly. So you get a number of us here. One of the questions we had that kind of follows up on what we were saying is, people have said they've always been told they can educate. And you've used the term engage or something today. Is engaging educating? Like, how would we make sure that we're, staying on the right line, but being as kind of active as we can while staying within that education bucket?
To me, everything we do is educating and advocacy. And so I don't try to draw lines. Anything to me, and like, I don't know, Sabrina, how you view it. As a lawyer, like to me, there's either lobbying and there's not lobbying. But everything is advocacy and everything is education.
Yeah, that's how we think about it as well. There's like a universe of advocacy activities of which a small subset constitutes lobbying. And yeah.
I want to answer the question Kathy raised in the chat. She's saying, if I'm in my own personal capacity, using my own phone, doing advocacy, is that cool? Absolutely. So what you do in your free time, after hours, on the weekends, is up to you. Whether you are, as the issues are is it paid staff time really is the key issue. Are you on the clock? Because if you're on the clock, then organizational resources are paying for your time. But if you're using your own personal email address, and if it's after hours or on the weekend, sure, you can do whatever you want. Some government, if you are in certain government roles, Hatch Act might apply, or various Hatch Act applies to political activity. There's very, very few restrictions because you still have your First Amendment right in your own personal capacity. So there are very few situations where you would have a restriction on what you're doing in your own personal capacity, as long as you're not invoking your role as a government employee.
Looks like there's another related question in the chat, so we can get to that if you'd like.
So Anna Maria asks about asking, can you come off of mute? I'm curious, I have a couple of questions there. Can you explain sort of the scenario you're thinking of? Or do you prefer not to?
Hello, can you hear me?
Yep, absolutely.
Hi, yes, so we have basically a big project here in Florida. Our providers for tobacco-free Florida are pushing for stronger policies, specifically our tobacco policies in our school district. And I'm trying to come up with creative ways where we can engage these school board members because their time is so limited. And there's that blurry line of advocacy and lobbying, which we're not allowed to do. Do you have any advice for us on how we can basically not convince them, but encourage them to review these policies to make them stronger?
And is that coming from a nonprofit organization, or are you talking as a government employee?
As a government employee.
Yeah. So there's two levels. So one, on the nonprofit side of things, school boards are not legislative bodies. So nothing that you're doing, if you are at a nonprofit, nothing you can do at a nonprofit can be trying to influence school board. Anything, let me rephrase it. If you're at a nonprofit, you can do anything you want to influence the school board. It just ain't lobbying. So by all means, nonprofits, go ahead and influence school board votes, not lobbying. But you're a government employee. And so the question you're saying is, as a government employee, what can I do to influence the school board, right?
Right.
Yeah. There's part of it is, it depends on what government body you work for and whether the ethics rules that apply to your government agency, and it depends on whether it's state or local government, things like that. So that's going to vary where you are in terms of what ethics rules apply to your job. But almost universally, as a government employee, you can invite school board members in to learn about what the situation is in schools, and to having them do a site visit to the school, meeting with students, meeting with faculty, with teachers and administrators. Those are generally all things that you can do regardless, because that would be treated as an educational visit, bringing them up to speed on the policy issue, where you're not talking about, you don't talk about the upcoming vote. You don't talk about the, the specific policy that you're pushing them to adopt, but you're merely saying, we want you to get information. So it's a matter of sort of where the line is in that situation is you'd be talking about, here are the conditions we're seeing, but you're not necessarily, depending on the restrictions that you're faced, would depend on whether or not you can talk about, here's the solution that we think is most applicable. And so it really depends on what your government body is when you're bringing that in. Sabrina, do you want to add anything to that? Okay. But that's a great question. Thanks for asking it, Anna Maria.
Thank you so much.
And just to build on that, that is an example of a place where you can do some of the work to educate people and to raise the issue on people's radar screen. And then you might be working in a coalition with folks in the nonprofit sector who could then move that issue a little bit farther along. Folks from, local tobacco-free kids or other tobacco organizations or what have you, you could say, hey, I met with these school board members. They seemed really interested in this. You might want to follow up with them to help them, learn more about what they can do as a solution.
Great. Thanks for addressing those. Wanted to flag another question that we've gotten, kind of jumping all over the place here. Can you share the health impact of a bill or decision without being lobbying? There's a little bit more detail to that. So we discussed asking the health department employees to talk about the health impact of, say, reducing childcare vaccination requirements. The health impact would be X. I'll paste that in the chat for reference.
I also think this is connected to the next question, Raya, which is, what can we tell the public when they ask us about proposed legislation? And I know those are two different audiences, but to me, it seems like we're basically going through one more repeat and reminder of how to walk through the 4-part test.
Yeah, so as Sabrina said, a communication with a legislator is a communication with a legislator or staffer that reflects a view on specific legislation. And so I think the question here is, what does it mean to reflect a view on legislation? And so it's much broader than simply saying, vote yes or vote no on this bill. In most cases, the IRS says is, you don't have to just say vote yes or vote no. It's anything that reflects the view on the legislation. So sharing the health impacts of a bill is probably reflecting a view on that legislation. What Sabrina talked about, doing nonpartisan analysis, study, and research. So if you're doing analysis of the bill and you're saying, this is what the health impacts are, but it's a very balanced presentation of the information, and someone could, an independent person could reach a viewpoint that's opposite of yours, that could fall into the nonpartisan analysis and study exception. The bottom line, though, is you're going to wind up crossing the line. A legislator doesn't want to know, legislator's not talking to you because they can't read the bill. They can read the bill and know what the bill is. They want to know from you, in your expertise, is this bill good or bad? They don't want to get a précis on, here's what they don't want to read a scientific report on how many deaths will result or won't result. They want to know from you, is this important for our community? And so that's why it's really useful for you to have some amount of lobbying dollars to spend, so that when those legislators come to you asking you about a bill, you're not stuck simply regurgitating the bill back to them, to be able to say, here's what the here's what the bill is going to do specifically. So the example here about asking health department employees to talk about the health impact of reducing childhood vaccine requirements. So if they're talking to legislators about a bill that would weaken childhood vaccine requirements, it's very likely that they're going to reflect a view on that bill that it would be damaging and harmful to children in the community to weaken these requirements. I mean, you could imagine like a bunch of lawyers sitting around a table could come up with like talking points for how you could have a balanced exposition about the costs and benefits of reducing vaccine requirements. But put anyone from public health in front of a senator, they're going to be like, yeah, it's nuts to reduce childhood vaccine requirements. It's going to harm our families. It's going to harm our kids. So that's not a fair and balanced exposition of the issue.
But Alan, can I so what, I think this question is saying there is a bill, but like, what if we're just worried because there are bills floating around all over the place with vaccines, but they, there's not necessarily a specific bill in my jurisdiction around this, then we're talking about a different scenario. That's more
a different
education around what policies hypothetical policies unintroduced yet might do, and maybe encouraging not to introduce one in the first place, right?
Right. So
Yeah.
it's only lobbying if you're under these IRS rules. This is what's related, for nonprofit grants. If you're talking to a legislator about broad policy issues, but not talking about specific legislation, that's
Right.
totally fine.
Right.
It's not lobbying.
Right.
And if you're talking to the public, you can talk about legislation as long as you don't include what Sabrina said the IRS defines as a call to action. So you can talk to the public about specific legislation, reflect a view on that legislation. It's not lobbying unless you then say, so call your senator, or your state senator's phone number is blah, blah, blah. So there are certainly ways that we can make the context be non-lobbying and do important public education and advocacy around these concepts.
So the other follow-up, like I'm gonna just play the devil's advocate here, insert my own hypotheticals in case they're helpful, but for the vaccination, like health impact question is, I can also imagine there might be ways that to talk about that fall under some of the exceptions. Not that the exceptions can necessarily be manufactured, but that could be a place where you might be requested to testify. What would the health impacts be under the IRS rules? And like, then you want to get it in writing with specific documentation, or that there might be some relationships you have sort of in the context of your normal executive legislative functions, for example, where you're asked to sort of talk back and forth about some of this. Do you want to comment on that at all, or say more since you know more than I do?
Well, yeah, I mean, if there's a hearing coming up, you could testify. It's important to get one of these letters. The invitation letter has to be from the committee chair on behalf of the committee. It can't just be from crazy backbencher who supports your idea. But if you can get a letter on behalf of the whole committee, one of these invitations, it's relatively easy to do. And even if the committee is in hostile hands, they're usually pretty willing to do it if asked by a colleague out of professional courtesy. So that's certainly an option for it. But I think that people underestimate how much you can say in terms of public education that's advocacy, but non-lobbying. So for example, I'm thinking about, in Maryland, there was a bill a Healthy Kids Meal Bill to eliminate soft drinks in meals. The Heart Association and Sugar Free Kids Maryland ran an op-ed in the Baltimore Sun, and the op-ed said the city council should pass this bill on Monday. This is a hugely important bill. The city council is going to be voting on it on Monday. They should vote yes, it's going to do all these great things for health in our community. All non-lobbying dollars to publish that op-ed because there is no call to action as the IRS defines it. Now, after they published it, they flooded social media with calls to action and saying, hey, check out today's op-ed by Pastor Slayton. If you care about this issue, call your city council member at this number. They targeted their email list, their email outreach to people and said, hey, check out today's Baltimore Sun. Contact your city council member is so-and-so. call her right now. The op-ed was really expensive because it takes a lot of time to write and publish and place an op-ed. So they wanted to use non-lobbying dollars. Those emails and social media took half an hour, really good use of lobbying dollars because it's going to have a high engagement rate, high return on investment there.
Great. Thank you for providing that level of detail to that question. That was really useful. I have one more question that we'll address from the submitted questions, and then we can open it up for the last few minutes to anybody who might have any more specific questions. But we got a question about is APHA resources specifically. So I think Angie can help us address this one. But does APHA have any other resources that we can use in our advocacy efforts?
Definitely. So APHA, as you all know, has policy statements. We have other advocacy tools like Speak for Health. Raya, I think we'll put the links in the website, but please know that you can use those. Specifically related to that, there will also be a training January 5th that I think Lindsay mentioned at the very start. We'll also send you information about that. But really, we'll talk about some of our affiliates have been able to use policy statements and other resources really to help communicate messages within their own states. And then specifically around public health authority and some of these challenges that we're dealing with, thinking about how to advocate, finding out where to ask questions like the ones that are coming up now. We also have a toolkit around public health authority that includes resources from Act from Public Health and American Heart Association and others that you all also are welcome to call on. Finally, I would just say you're also welcome to call us. We can link you to all these different partners. Alan is actually available to answer some specific questions if you have them. So please give us a call before you cross any lines that you're worried about. We're happy to also ask specific questions, knowing that, of course, you may have to consult with your own attorneys also to make sure that everything's clear. But hopefully these are helpful resources. We'll also share the slides from this meeting. So all of those are available for you all, but let us know if there's something else you need, and we'll try to see what we can do about getting that also.
Yep, and we've had some questions come in under the wire here, so I don't, let's see if we have time to address one or two more, and then we can wrap up. One that came in from Mark is, we are a county local health department, and we meet with our state senators and state representatives each year to share our association public health legislative priorities in the upcoming session, but generally no bills have been filed yet. So the question is kind of around these specific activities, if they're education or lobbying. So
yeah, I mean, well, there's two issues. One is your county might not prevent you from lobbying state legislators. You know, there's every county and state local government is going to have different rules about whether or not you can lobby on bills. So and how they define that lobbying is going to be different. So it may be totally fine under your county, the rules for county employees to be talking to legislators anyway. So that's totally fine to begin with. So that's step one. And step two is, it doesn't necessarily absolve you if there's no bill filed yet. If, you know, the bills are probably in, you know, being marked up or being written up and stuff like that. The key is, are you talking broadly about priorities? And it sounds like, you know, in this hypothetical, they're talking broadly about policies and what's needed, as opposed to, hey, we need you to change this line item from 7 to 15 or whatever. And so that could be another dimension that they would want to think about.
great.
So
Yeah, thank you for addressing that.
sure.
As a final recap, you know, all of us can educate. Lobbying is very specific, and most of us in public health can do the work of education and even some level of advocacy. So it's important to know that threshold, but also important to act in ways that we can. So thank you all so much for your time today. We will follow up with the recording, the slides, and any questions that we did not capture answers to. Thank you, everybody.
Thank you all.